Now, I would like to introduce our speaker, Dr. Sandip Deshpande, sir, once again. Dr. Deshpande is a psychiatrist and a sexual and relationship therapist at Allo Health. He did his post-graduation in psychiatry with gold medal in 2003. Following 1 year of research post at NIMHANS, Bangalore, he worked in the UK for almost 8 years. He has led psychosexual medicine service in the capacity of a consultant in Leeds, UK. Dr. Deshpande believes in a holistic approach to treating any psychological distress using counseling and psychotherapy approaches in addition to using medications where needed. He is also keen in teaching and training and is currently helping a cohort of young doctors hone up their skills in sexual medicine at Allo Health. With this brief intro, I'd like to welcome our dear speaker for the day, Dr. Sandip Deshpande, sir. Welcome, sir. The stage is yours.
Can I start? Okay.
Yes, please.
Yeah. Wonderful. I will share my screen. Thank you very much, Dr. Venkatesh, Dr. Parthiman. When we approached the IMA Junior Doctors Network, we were a little skeptical, thinking, would you be interested? I think the response has been just amazing. You have welcomed us, you have taken pains to understand what this talk is about, and you have organized it so well and absolutely on time. So I appreciate all of that. So thank you very much. I'll try to showcase sexual medicine as a specialty, but I must make it clear at the outset that unfortunately the MCI/the NMC now do not recognize sexual medicine as a branch in its own right. So when I was doing my MD about 20 years ago, I used to almost chew my professor's brains saying, why don't you teach us more? I'm giving patients some medicines which cause sexual dysfunctions as a side effect, but I really don't know enough to reverse those or treat them. So this curiosity went with me when I went to the UK, and over there I was lucky to get training, and I'm back in Bangalore for the last 10 years, where I practice as a psychiatrist and as a sexologist. I've joined hands with Allo Health, which I believe has taken this very seriously. So Allo Health does three things. They are a company who do consultation for sexual dysfunction. The second vertical is teaching and training young doctors like you. The third thing Allo Health does, and I believe we do it well, is public education. So do visit our website, have a look at our blogs, some videos that we have created, and also look at our YouTube channel. In fact, there's a new program called Ask the Sexpert. Very high quality videos and very informative, easy to understand. So today I'm here to talk about the second vertical, which is teaching and training and offering this as a specialty or a subspecialty. If you have any questions, please type them in the chat window. I'm happy to take your questions in the end. If you need any articles or any resources, don't hesitate, just get in touch. The last slide will have my email ID. So you can always drop me a line or ask for any resources that I'll be able to offer. So I'll be talking very briefly about Allo Health, sexual medicine as a specialty, and job prospects. So let's start with the introduction. As I mentioned, the specialty itself is unrecognized. So you can imagine teaching and training itself will again be something of a stumbling block. Very few Indian universities or institutes offer a training program. There is a crash course, 10-day course, which happens through the ESSM, European Society for Sexual Medicine. And at the end of that course, there is an exam. If you write the exam, there is a fellowship that is provided. Again, I don't think that fellowship is recognized by the NMC or the medical councils with whom we register. But nonetheless, it gives you, the knowledge and the information that is necessary. Uh, I truly believe that a population as large as ours, 1.3 billion or 1.4 billion, somewhere roundabouts that, we need an evidence-based practice which helps clinicians to diagnose these problems and treat them. So this is a question that was answered on one of the public forums. I have deliberately left the qualification of this doctor. He's from the uh, alternate medicine. So the question is about effect of masturbation on health, weakness. Does it cause low stamina? That's the question the patient is asking. I am appalled by the answer. That's all I can say. There are about 10 to 12 lines here. You can pick any line. For example, I'm picking this line somewhere in the middle, which says, it is like a tank getting filled through one pipe and getting empty through the other pipe. So such responses are being given by doctors. People already have a lot of, um, you know, misinformation and myths and misconceptions. These only make things worse for them. Wait before you cheer, because there's one from our own fraternity. This particular doctor, I have, not told you who their name or where they are from, but this is an MBBS doctor, and the doctor is asked the question about how to increase the size of the penis. The first few lines are fine. Avoid drinking, smoking, do some exercise, eat green leafy vegetables, spicy foods, oily foods. The last line shocks me. Apply coconut oil on the penis twice a day. So I think this particular doctor is a fellow from somewhere in South India, I suppose. I'm from South India. I have no shame to say that. But no, applying coconut oil or any oil on the penis does not help increase the size of the penis. So this is just to give you an idea of the kind of things that are conveyed to patients. What is sexual medicine, or some people like to call it as psychosexual medicine? It's a marriage between various specialities. There is psychiatry, psychology, different branches of medicine. In India, with about 40% of the population being under 30 years, we have a lot of people who do not have a hardware problem, hardware, software, yes. So hardware for either men or women in sexual medicine is blood supply, nerve supply, and hormones, the sex hormones. There are only three things for the hardware. Typically, these don't get affected. So the software, the psyche or the mind, hence the term psychosexual medicine. Okay, sexual medicine is a quite a broad-based branch within itself. Just to give you an idea, there are about 40 plus journals, peer-reviewed. These are listed on Wikipedia. I thought I'll just share that with you. Everything we do in sexual medicine follows the acronym DOR. So from this talk, if you want to learn any basics, carry home this acronym DEOR. Desire, because that's what starts everything, and the desire starts in the mind. Excitement, non-sexual excitement is same for both men and women. Increased heart rate, increased breathing, sweating, general excitement in the entire body. Sexual excitement for men is erection. Sexual excitement for women is lubrication in the vagina, increase in the size of the breasts, and erection of the nipples. That is followed by orgasm or climax. In men, it coincides with ejaculation. In women, orgasm happens in multiple ways. Few women are able to climax through penetrative sex. That's called vaginal orgasm. A large majority can climax through non-intercourse methods, clitoral stimulation, stimulation of the breasts and some other erogenous areas. Once orgasm happens, everything reaches the baseline, hence the rest or resolution stage. Important to know this classification because the sexual dysfunctions are divided based on Dior model. So just to get your head around, I'm truly giving you a very broad overview today. So there are desire issues, low and high desire in both men and women. Excitement issues, in men it is erectile dysfunction, in ladies it is lack of arousal, female sexual arousal disorder it is called. Climax related problems are early ejaculation. If a man ejaculates under 2 minutes all the time, most of the time, there are wide debates about whether it should be under 2 minutes or under 1 minute, but the average duration is between 2 to 5 minutes after intercourse. What people see on pornography is not true for everybody. Delayed ejaculation, also called as retarded ejaculation, if a man is not able to ejaculate even after about 10 minutes or longer and he gets frustrated. In women, inability to orgasm is called anorgasmia. Then there are some pain disorders. Dyspareunia is a general term for sexual pain disorders. Vaginismus is a very specific condition. In women, it has fear of penetration and a lot of avoidance behaviors. So if you ask me what are the common conditions we see at Allo Health, it's the low sexual desire, erectile dysfunction, premature ejaculation, and vaginismus. Those are the 4 or 5 conditions that we see routinely. You saw those two case scenarios in the beginning, how doctors have responded, whether modern medicine or alternate medicine practitioners. There's a very simple technique called as the PLICIT model. It's an acronym: permission giving, limited information, specific suggestions, and intensive therapy. So we do short courses at Allo Health, and most of our doctors who attend these courses, it's for about 2 hours spread over 6 weeks. They get easily up to level 3. So permission giving is if a patient comes to you and is very worried about masturbation. um, Look, masturbation is safe and healthy, especially if they are single, they don't have a partner. What is not okay is compulsive masturbation, where they are doing it multiple times in a day, or they are doing it only because they are not able to sleep, or they want to do it to relieve stress. So permission giving is, telling them the right information, giving them the right message. Limited information will be, let's say, explaining to a lady about the female genitalia. Many women believe that the vagina is a hole. The vagina is not a hole. The vagina is an opening. And when a woman is excited, there is lubrication. So intercourse does become painless. That is limited information. Specific suggestions: if a young man comes to you and says he ejaculates very quickly, teach him some techniques. There is a technique called stop-start technique. So that can be taught easily. So our experience has been that teaching doctors these basics gives them the confidence to deal with common sexual problems. The last of the skills does require more training. That's the intense therapy. Okay, we use something called as the MIST model. Unfortunately, today, the way sexual medicine is practiced in India, it is largely sexual pharmacology. And let me disappoint you by telling you that there are only 5 drugs that can be used in sexual dysfunctions. What are those? There are a couple of PDE5 inhibitors. You must have heard of sildenafil. There is the next generation called tadalafil. And there are maybe 1 or 2 more of the PDE5 inhibitors which are used in erectile dysfunction. Then for premature ejaculation, we use the antidepressant group SSRIs. There is one more called dapoxetine. And then perhaps there are some nutraceuticals and some local anesthetic gels. So there isn't much. And non-responders of these drugs are as high as 50 to 60%. So we at Allo Health, we have well, we didn't pioneer this. It's called the multifaceted intervention in sex therapy, or you can call it multi-integrated sex therapy. This was something that was spoken about by my teachers, Brian Daines and Ruth Hallam, from the center I trained in UK. So we use medical approaches, we use sex therapy approaches, we use detailed, therapy and CBT, or to put it simply, we use pharmacology after a detailed evaluation. If men require any kind of surgical intervention like phimosis, we send them over to surgeons in their local area. We use medical treatment for conditions like diabetes with the help of physicians. We use devices, investigations, therapy. I'll show you a few sample examples of, some of the educational material that we have developed. We can even share something on this group today. So we believe a lot in using therapy along with medications, especially couple intimacy therapies. So these are the handbooks that Allo Health has developed. If we are able to share on the chat window, we will do that just to give you an idea. Or some of these are downloadable from our website. So Allo Health offers end-to-end solutions in sexual health. And our mission and vision is to offer sexual health services by trained professionals. So we do this currently largely online, but we also have a clinic we have recently opened at Bangalore as a pilot. So why did Allo Health choose to start a sexual health clinic? Just a simple math will tell you that for the Indian population, if you look at sexual dysfunctions, which are currently about 25 to 30%, and there are some robust studies to prove this. There is something called as the NATSAL study, the National Attitude and Lifestyle Survey that happens once in 10 years in the UK. So we are actually looking at huge numbers who need help. This is from the platform Practo, where we try to look at a patient who wants help for premature ejaculation in different cities. If you are from one of these cities, just have a look across the row. In my city, Bangalore, only 13% of modern medicine allopathy doctors said that they are happy to treat premature ejaculation. Rest of it was alternate medicine. So we can be easily trained. You have the knowledge of anatomy, physiology, pharmacology. Some of you, who are interested and are in the fields that I mentioned earlier, you need to bring all your knowledge in one place and have the confidence to treat. It's become a Me Too branch, which means that anyone on the roadside can put up a tent and say that he's selling the Himalayan herbs, and they too have quite a clientele and a business. So our approach has been to put the patient first. We are not a product first company. There are companies who do that. If you go on their website, it's all about medication that is sold to you. We believe in proper consultations. We believe in investigations only when necessary. And we believe in offering a holistic care. So we have an assessment form which patient fills. If you're interested, you can go to the website as a dummy patient. And we wanted to make this democratic so people can actually take a test on the website. You can encourage your patients also to do that. And they get a report at the end of it. And those who need a consultation, they fill a form. Now, Allo truly has brought technology and clinical practice very closely. You can't replace the doctor, but if you can make a doctor's job easier. Previous to doing this kind of work, I used to take at least about half an hour to see a patient. Now, with the forms that are filled by the patient, I can easily do a consultation in about 15 minutes for a new patient. So this kind of a report is available for me. I know how old this person is, what is their BMI, what are the problems faced by them, are they married, do they have a stable partner, do they have any medical conditions. So with all that information available at my fingertip, consultation becomes a lot easier for me. So just to give you a flavor of the kind of people we see and how we go about treating, because it's not a one size fits all treatment. Um, let's say a 25-year-old single man who worries about not getting good erection during masturbation comes to us. Uh, this man probably doesn't require any medications. He needs more of the right education, information, therapy, giving some leaflets that he can read. And if he is still not confident, we will probably consider giving him an SOS medication. Um, if it's a 28-year-old man in a relationship who suddenly finds that he has lost his erection with his partner, he avoids any intimacy after that. Or take the case of, we call it as the honeymoon syndrome. This man, soon after marriage, after on his first night, tried to have sex and he's not able to sustain his erection, tries again a couple of times, and next week he's going to some exotic location for a honeymoon and he's extremely anxious. So such men, we would probably educate them, tell them the role of the mind over the body, importance of relaxing, importance of engaging in outer course. I didn't tell you what is outer course. So sexual activity is on a wide spectrum. Only one end of it is intercourse. The long end of it, we call it as outer course. Loosely, it is foreplay. So anything a couple does behind closed doors without clothes. So we would encourage this man to spend more time there so that he is not anxious. And we would send him with some SOS PDE5 inhibitors. A third gentleman, 55-year-old male, married, settled in a relationship, he says over a period of 1 year, he's been gradually losing his desire, his erection, both during masturbation and intercourse. This man, because he is over the age of 40, 45, and definitely above 50, we would think about organic causes, the hardware causes. We would probably get his evaluation for metabolic parameters, look for sex hormone profile, testosterone, and then in the metabolic profile, we look for lipids and sugars. So the approach is different for each of these gentlemen. So I would like to take a pause here and tell you how we train doctors who might be interested in learning from Allo Health. And we are calling it as the Sexual Medicine Certificate course. I must give you a disclaimer that currently it is not recognized by any university. We are approaching different universities. We are in the process of getting accreditation. But currently, it is run by specialists within Allo Health, and anyone who completes the course is given a certificate. You cannot use this certificate to say that you are a specialist, but the way things are currently in India, if you have an MBBS degree, I don't think you are prohibited from um, counseling or treating common sexual dysfunctions. What you can't do is surgical procedures. Yeah. So we have two courses, one for mental health professionals, another for medical professionals. Under medical professionals, we have an MBBS course and one for specialists as well. So I told you about the growing demand, and we are hoping at Allo Health that the need for sexual medicine experts is only going to grow. And our ballpark figure is we should be able to train about 1,000 doctors over the next couple of years. So this is the set of trainers. I am the lead, and I'm ably assisted by a bunch of specialists. So yeah, this list is growing. So the duration of the course is about 3 to 6 months. We are for the mental health experts, we are taking psychiatrists and psychologists. I'll just move to the next one, or maybe you can see the bit on the right, which is this is a structured modular training. There are live sessions. We are trying to host all of this on an LMS, learning management software. So there will be self-directed courses in future with a contact program with a trainer such as me. There are quizzes, assignments, and then discussions that happen. Those of you who are interested to take it further, there are research projects that we could do. We have created a unique component called the Allo Skills Corner. I mentioned about stop-start technique. So how exactly do you explain it, and what sort of tools do you use? There are images that we have created. So all that is taught in a very systematic and a methodical fashion under what's called as the Allo Skills Corner. So just to give you an overview for MBBS doctors, we cover basics of sexual medicine, where we talk about terminologies, anatomy, physiology, the different models. The one that you saw earlier is the Dior model. There are many others. The second module is specific techniques and treatments. Here we look at pharmacology, some common ways of counseling, then specific techniques for different disorders. Some contemporary issues also we cover, like porn addiction and aging and sexuality, pregnancy and sexual functioning. So those come in module 3. In module 4, we do talk about couples and relationship therapy, something that is very important because sexual activity doesn't happen in a bubble. Good relationship and good sexual relationship, the two are interconnected. So we focus on that. And finally, the skills corner. For MBBS doctors, we also cover general counseling skills, how to diagnose common mental illnesses, because there's a huge overlap. For example, somebody, either a man or a woman who has clinical depression, for example, their sexual drive can go down. So it is important to recognize those. Psychological approaches to treating illnesses is also something we cover. So once students complete the course, there is a continuous formal evaluation, theory and practical regular attendance. They are asked to do a teaching project, and upon successful completion, we give a certificate. So we have run a pilot program, and we are currently finishing another second batch of a proper course. So the pilot program happened in began in the month of September. There were 17 mental health professionals. It was done mainly for psychologists and psychiatrists. It was 30 plus hours of live training, and then there was post-course support as well. So just a snippet from everything that we did. So this picture that you see is of all the course attendees. My job becomes a lot easier because we have a wonderful tech team who assist me in making some great presentations with wonderful images that go and videos. So we received some fabulous feedback, and that ended up encouraging us to do our first full-fledged course, which is in the final week now. So we have 60 attendees on this one. And here we have MBBS doctors as well. So with the kind of encouragement we are getting from this course, we truly want to scale it up and make it big. That's why we are going to host it on a learning management software, wherein you will be provided access and you can go through the course in your own time. Um, you might be surprised when I say this, but the delegates did not pay anything to be on this course. So currently, the founder of Allo Health, Mr. Pranay Jivrajka, he believes that it is a duty that we have towards the medical fraternity to provide a course of this nature. So it is currently offered free of cost. Going forward, even if it is charged, I think it will be a nominal fee only. Okay, so talking about career option, one wonderful thing happened during COVID. Niti Aayog with the NMC, they legalized teleconsultation. So the teleconsultation guidelines permit you to do a consultation which is legal, which you can do in order to diagnose, to assess, and also to treat. So access to healthcare online is becoming universal. India is, by the way, the fastest growing country in terms of internet acceptability, and India is among the cheapest in terms of cost for data. It couldn't have been better, the timing. The trained experts are very few. So this is an area which is nascent, and you probably want to be there at the right time. And you can either choose to practice as a sexologist or develop it as a subspecialization. So whichever broad specialty you are in, you might want to tag along this as a subspecialty. And we believe that doctors can easily acquire this skill. So job opportunities with Allo Health, once people complete the Allo Training Academy, there is a personal interview. We offer a 3 to 6 months paid internship where people can actually get more of hands-on experience. And we have a 3-stage model during internship and onboarding. It's called Know It, See It, and Show It. So you know all the skills, you see your seniors in action, you record some, dummy consultations. That is the show it, and there is a supervision that is on offer. So at every stage, there is hand holding to give the doctor an opportunity to be comfortable and confident. So there are opportunities to take up, employment with Allo Health. So I'll stop here. I'm happy to take questions. I'm not sure if Dr. Parthiman or Dr. Venkatesh are able to pick questions from the other forum and then put them here, or how is it going? I'm not too sure. So I have a few questions that are here. Sorry, Dr. Venkatesh, you were saying something?
Yes, the participants who wants to ask questions, it will be typed in the chat box and it will come to our Zoom automatically.
Okay.
So we have one question with this.
Right. I'll do. Sorry. My apologies. I have two of my colleagues, Dr. Meghna and Dr. Simran. Both are MBBS doctors. Dr. Simran joined us about 3 months ago, and Dr. Meghna has joined about a month ago. They are there here. If with your permission, if I can request them to share, their thoughts about how the journey has been. I've told them strictly, please don't praise Allo Health and don't praise Dr. Sandip Deshpande, their trainer, but just give a narrative about how their journey has been. So, Dr. Simran, are you able to unmute yourself first?
Yes, sir. Hello, good evening, everyone. I'm Dr. Simran. I'm a physician working with ALO. I'm right now consulting for sexual medicine. Excuse my voice, just a little sore throat. Okay, so I think in terms of my journey with sexual medicine, I really was not aware of a lot because as an MBBS student, you're not really taught much regarding this subject. It is extremely, how do I say this, ignored, if anything. We don't really pay a lot of attention. But I was extremely personally very much interested in this scheme or in this area of topic. Then I came across ALO, and I heard from my senior that they were doing a training academy. And that's when I found out about this and I joined. I also heard that they were hiring. So I thought, why not also start practicing, which is why I took up both. I took up the course as well as the job opportunity. Throughout my training, I initially believed that sexual medicine was something that only required medication to treat, but I am learning now that it's almost a holistic approach, and it is something that it's actually a holistic approach. It requires your mind, your body, your lifestyle, all of it combined. And I think having certain basic knowledge regarding any kind of sexual activities is extremely important to be able to firstly to even consult, to even be a doctor in this area. And I think that's what ALO has given me. It has given me a certain know-how of how you can go about treating a patient from a person that is extremely lacking in knowledge to a person that knows everything and also is still facing problems. Well, it is extremely interesting to me. And I know Dr. Sandip said don't say things about me, but I'm extremely happy that he is my mentor because I have learned so much in the past 4 months actually. But this is something that I think getting to know or learning about this has made me more interested in continuing in this stream of medicine. And yeah, I think that's about it.
Thank you. Dr. Meghana, if you're able to add on to what Simran has said.
Yes. Hi, everyone. I'm Dr. Meghna. So I finished my MBBS in 2020, and I have been working in different setups till now. Like I have been working in clinical setup as well and digital healthcare platform also. So recently I've joined Allo Health. So like why Allo was the decision I made because I think as MBBS students, when we were in college, the number of patients we have seen of sexual dysfunction is like very few. Probably in some postings during internship or probably one or two females in OB-GYN where they come for dyspareunia or any vaginismus complaints. But it's just the tip of iceberg. There are a lot more patients. And as Dr. Sandip told that we have 3 different stages in Allo where it's know it, see it, and show it. So I think I'm also part of Allo Training Academy, batch 2. So I'm almost done with my course. And as of now, I'm in the state where I have to show to the team that, I'm capable of, consultations or the assessments. And now I can say that I'm confident because with the resources available at Allo, as Doctor said that we have a very good tech team, the content team. So they have made a lot more leaflets and resources, and also in the training, the course, Dr. Sandeep has been giving us homeworks as well. like to read journals or articles. And also there are quizzes like pre-quiz and post-quiz. So I think all of that is helping us, I think, to be confident. Because in order to help patients, I think we should be first confident. So I think I can confidently say that now I'm in a position where I can help patients who come with the complaints of sexual dysfunction. Yeah, so I think that is it.
Thank you, Dr. Meghna and Dr. Simran. Dr. Venkatesh, there is a question. Can I take that?
Yes, sir. I invite Dr. Charan to please handle the Q&A session.
Okay. So, yeah, this question is
Dr.
from
Charan,
Ankita.
are you available?
Hello.
Yes, sir. So I request Dr. Dhanush kindly read the question for sir so that sir can answer those questions.
Okay. So there is one question by Ankita. Ankita says, trained in family medicine, working in health service. I would like to know about courses offered by ASECT. ASECT is the American Association of Sexuality Educators. Yeah, they do offer courses, but I mean, pardon me, I think this is limited to sexuality education only. It's not about treating sexual dysfunctions, the ASECT course. I mentioned about the ESSM course, European Society for Sexual Medicine. Now, this one is for doctors. So it covers sexual dysfunctions and their treatments. What fellowships are available in India? There is a course by JSS Mysore. That's the only university accredited course I'm aware of. Then there used to be a course by the IMA. I am not too sure if that is still running. JJ Hospital in Mumbai, they run a fellowship course. It's a year-long fellowship course. I'm aware of that one. Okay, the next question is about what are your thoughts about female clitoral injections for female orgasm and cosmetic gynecology? Okay, I'm not aware of clitoral injections. I'm not sure if you are asking about Botox injections. Botox injections were thought to be useful in vaginismus. So the same principle, skin creases on the face. When you inject Botox, it paralyzes some of the muscles. So those creases no longer appear prominent. So by paralyzing the pelvic floor muscles, it was felt that it would cure women of their vaginismus, but it's not been very promising, I would say. So, right, some more questions. I'm interested in this is Dr. Abhirami asking, interested in fellowship in the field of psychiatry. Is there any possibility to do a fellowship in psychiatry? I don't know. You have to be a psychiatrist first, and then only you can do fellowships, which are postdoc and fellowships in specialities. So, for example, fellowship in child psychiatry. So you can do that only when you are an MD psychiatry. Okay, I'm an MD biochemistry. I worked as an assistant doctor at my partner's maternity hospital and started practicing sexual medicine. I recently completed ESSM school in 2022. Well done. What is your opinion about sexual medicine practice after training by the ESSM? As I mentioned previously in my talk, the ESSM course, it gives you a certificate, but I don't think you can register that you can attach that to your degree and register with your state medical council. You can find out from them. It's a gray area. The council doesn't stop you from practicing, but again, you'll have to practice within your limits, I suppose, which is, you wouldn't do surgical procedures if you are an MBBS doctor, unless you are trained in it. Any other questions?
I think if audience have any questions, they may kindly type in the chat box. So
Yeah.
sir can take the questions. Okay. If not, I'll request Dr. Parthiban to please continue the session.
Okay, thank you, sir. And thank you from the bottom of our hearts for this excellent session, Doctor. Hope the knowledge gained from this webinar will be of immense help to our junior doctors. And special thanks to Dr. Meghna and Dr. Simran too, who have participated in this. And this knowledge gained during this session will always be experienced for us to pursue our career in sexual medicine in future. Thanks a lot again, sir, for your time. And to end up this session, I call upon Dr. Raghunathan, sir, National Joint Secretary, IMA-MSN, to deliver the vote of thanks. Before proceeding to that, please note that the certificate for this event will be mailed to you within 10 days from today. Over to you, sir.
Greetings to all the participants. Thank you, Parthiban, for your wonderful introduction. So, myself, Dr. Raghu, immediate past convener of IMA-MSN TN and founder of Medusane Academic Forum. Though sexual health is well-established field in the UK, US, and other parts of the world, still there is a huge stigma among our community, especially Indian medical graduates who are thinking to pursue their career in the sexual medicine. I thank Dr. Sandip Deshpande, sir, medical lead at Allo Health, and psychiatrists who have accepted our invite and gave a wonderful orientation to the participants on the developing scope in sexual medicine branch and share his experiences with the junior doctors of the country. IMA JDN Tamil Nadu always breaks the taboo in the society, and we organize wonderful orientation sessions for the junior doctors of the country. Today, IMA JDN TN, under leadership of Dr. Abul Hasan sir and General Secretary Dr. Venkatesh Karthikeyan sir, who have wonderfully organized this orientation session. I think this will have an impact among the society. I thank Dr. Charan and Dr. Parthiban for wonderfully taking forward this session and hosting them successfully. I hope that this session will be an eye-opener for the junior doctors for understanding the branch. Due to various stigma and taboo, sexual health is most neglected part in the individual's health of the country. The lack of sexual health specialists confuses the patient regarding who to seek the care. I hope that the government of Tamil Nadu and NMC will take this seriously and change the current medical education and address the sexual health by including it in the medical curriculum and recognize it as a branch in the future. Thank you, sir, and thank you so much.
Thank you once again, sir. And finally, I'd like to thank once again Dr. Sandip Deshpande for taking his time and to attend this webinar, and Dr. Venkatesh Karthikeyan sir for organizing this event, and Dr. Raghunathan Ramanathan sir, my senior, to give me this chance. Thank you all, and we are closing now. Hope you all had a good day.
Thank you, Parthiban. Thank you, Sandip sir.